Hello everyone, and welcome to our talk about designer drugs and psychostimulants. First off, we're going to focus on a class of drugs called amphetamines, which are considered psychomotor stimulants. So, let's break down this term. Psycho refers to the mind, and motor refers to movement. So a psychomotor stimulant is essentially speeding up mental and physical function. Specifically, psychomotor stimulants like amphetamines can create a sense of euphoria, increased alertness, sex drive, confidence, and decreased appetite. Amphetamines can also cause local motor stimulation, meaning increased movement, as well as increased talkativeness. Amphetamines are used to clinically treat disorders like ADHD and narcolepsy. And why would that be? Well, let's think about it. ADHD causes a decreased ability to focus, so stimulating mental function through amphetamines can fix this issue, right? You're providing a mental boost to the brain. Narcolepsy involves a sudden loss of alertness, and psychostimulants basically counteract this, right? They increase your alertness and your energy. So, how do amphetamines work? Amphetamines target the amine neurotransmitters of the central nervous system, including dopamine, norepinephrine, and serotonin. If you remember from previous videos, dopamine is a major neurotransmitter in the reward pathways of the brain. So when psychostimulants increase dopamine signaling, they can produce a sense of euphoria or pleasure. Increasing norepinephrine signaling can cause the increase in energy seen with psychostimulants. And then increasing serotonin signaling can stimulate a boost in mood because serotonin is very involved with regulating your mood. And what exactly do amphetamines do to boost the signaling of these neurotransmitters? Well, let's review some background knowledge. Neurotransmitters travel through neurons, the cells in our brain, and between these cells we have a gap called the synapse. When neurotransmitters cross from one cell into the synapse to stimulate the neighboring cell, they will eventually be mopped up and transported back to the original cell after they've done their job. The transporters in the cell membrane of the original cell are responsible for transporting them back into the original cell. But amphetamines will reverse the action of this transporter so that more neurotransmitters go back into the synapse. Because more of the neurotransmitters are in the synapse, the neighboring cell will keep binding to these transmitters and receive signals, thus producing more and more of the effects seen from these chemical messengers. The brain will soon realize that the synapse is being flooded with all of these neurotransmitters, so it's going to downregulate the amount of neurotransmitter receptors for specifically dopamine, norepinephrine, serotonin, which is why it will later take a higher amount of the drug to achieve the same effect, because there's not as many receptors to actually receive those neurotransmitters. So what are some of the negative symptoms from amphetamines? When someone's body becomes dependent on the drug, and then the person tries to discontinue the drug, the person can go into withdrawal. And especially amphetamines are targeting the reward pathway, right? So our body, whenever the body senses that there's something rewarding, it will try and achieve that rewarding sensation again. So it's going to want to take the drug again. And so once you get dependent on amphetamines, you're at risk for withdrawal and overdose. And so with amphetamines, withdrawal symptoms are mostly psychological, including depressed feelings, prolonged sleeping, overeating. It also includes feeling physically ill without a physiological explanation. And when someone takes way too much of amphetamines, they can overdose. And they can have symptoms like hyperthermia, which is basically an increase in body temperature, right? You've probably heard of hypothermia, where the person's freezing, so just think of the opposite of that. Hyperreflexia, which is describing increased muscle twitching. It can lead to seizures as well. And tachycardia means an increased heart rate. And so the symptoms here may not seem super dangerous, but overdosing on amphetamines can have many more incredibly dangerous symptoms. So now we're going to move on to another drug, cocaine, which is another psychomotor stimulant. Cocaine acts on three neurotransmitters, dopamine, serotonin, and epinephrine, which is similar to the neurotransmitters involved with amphetamines that we just talked about. So what does cocaine actually do with these neurotransmitters? Well, normally, after these neurotransmitters cross the synapse to bind to the neighboring neuron's receptors, it'll be taken back up into the original cell or mopped away, as we previously discussed. Cocaine will block the action of the neurotransmitters, forcing the neurotransmitters to stay in the synapse for longer and thus to keep stimulating the neighboring cell and produce that effect of the neurotransmitter over and over again. Cocaine is incredibly dangerous. The negative side effects of cocaine include hallucinations, paranoia, psychosis, restlessness, as well as several cardiovascular issues. Cocaine can cause the blood vessels to constrict, which is known as vasoconstriction, as well as the hardening of the arteries and capillaries, which can increase the user's risk of atherosclerosis, a disease that's literally the hardening of the arteries via the formation of plaques in the arteries. And in fact, 28% of people who died suddenly after cocaine use showed severe atherosclerosis-related coronary artery disease, showing the drug's potential for causing cardiovascular and specifically artery-related issues. Cocaine can also cause a cracked lung, where the lungs become irritated and inflamed, leading to potential respiratory failure, meaning they can't actually breathe properly, as well as hypoxemia, which is a low level of oxygen in your blood, hemoptysis, which is essentially the bleeding of your airways, as well as fever. A crack baby is a child whose mother used cocaine during her pregnancy, which can lead to many cognitive developmental issues with the baby. Cocaine can also cause Ekbom syndrome, which is where the patient believes that they're infested with parasites, so they keep scratching their skin, potentially causing severe damage to their skin. And now we'll move on to ecstasy, also called MDMA or Molly. Recreational use of ecstasy was popularized in the 1970s and 80s, and it has also earned a Schedule I classification from the FDA, meaning it has a very high potential for abuse and no acceptable medical use. Ecstasy has psychoactive effects, meaning it boosts the user's energy, distorts their sense of time and perception, and can also enhance their sensory or tactile experiences. Tactile just means related to touch. Ecstasy acts primarily on the chemical messenger serotonin, which is an important neurotransmitter for regulating mood, aggression, sexual activity, sleep, and sensitivity to pain. So, what are the negative effects of ecstasy? Like cocaine, ecstasy can cause cardiovascular problems because it increases your heart rate, blood pressure, as well as your body temperature beyond homeostasis. When the body temperature rises far above the baseline, organs like the liver, kidneys, and organs in the cardiovascular system can face damage. And why would that be? Remember that our body requires, again, a state of balance, and increasing the temperature extremely can change the structure of proteins in the body, as well as how chemicals are moving throughout the body. So that was a pretty vague description, but just to give you an idea of why temperature will be related to your bodily function. Ecstasy can also damage serotonin circuits, and when the body's serotonin levels are too low, it can cause disruptions in mood, like depressed feelings. I've also included several other negative effects here, like ataxia, which describes the loss of control of bodily movements. Someone with ataxia might exhibit slurred speech, difficulty walking, lack of body coordination, etc. And ecstasy can also cause blurred vision and dried mouth. So, ecstasy falls under a category of drugs called designer and club drugs. These classes of drugs are synthetic legal substances that have psychoactive effects and are often used by youth at dance parties and night raves. So club drugs include ecstasy, roofies or rohypnol, ketamine, and GHB. Rohypnol and GHB are depressants, meaning that they slow down the body, so they can be used as sedatives. Euphoria, increased sex drive, and tranquility are reported positive effects of GHB abuse. Negative effects include sweating, loss of consciousness, nausea, hallucinations, coma, among other side effects. Rohypnol can act as a muscle relaxant and decrease anxiety, but it can also impair mental function, cause confusion, and most of all, increase drowsiness and sleepiness. So ketamine is a bit different from all of these. Ketamine is also used as a depressant to legally treat depression, and also it's used as a veterinary anesthetic. Ketamine takes effect within 10 minutes, and when taken in a large amount, can cause hallucinogenic effects for up to 1 to 2 hours. Ketamine has actually been found extremely helpful with depression by regulating the glutamate signaling in the brain, although glutamate is not the most common neurotransmitter of focus used in antidepressant treatments. So I hope this video was helpful. I know we didn't cover certain drugs as much as others, but if you're interested in learning more about these, I would definitely recommend checking out these 3 YouTube channels. They're super good with talking about drugs and neuroscience or medical concepts in general. So Neuroscientifically Challenged includes 2-minute neuroscience videos that are very good for helping you understand the basics of neuroscience. Osmosis has a bit longer videos, as well as Concept Clear has longer videos. Concept Clear with these types of drugs focuses more on the pharmacological aspects of it, so goes a lot more into like clinical uses. And I also used Dr. Elliot Carthy, who has a YouTube channel, and I also used the American Addiction Center's website, which has a lot of information on different addictive drugs if you want to read more about those. So if you have any questions, just put them in Google Classroom and we'll do our best to answer them.